Hi everybody, my name is Nurul Shamimi binti Abdullah and my matrix number is 2019-255-632. So, today me and my friends gonna present and share a bit information about acute lymphocytic leukemia disease. Before we go further, let's get to know the members of this group.
Hi, my name is Putri Nur Atira Balkis binti Ottoman. My matrix number is 2019279576.
Hi, my name is Miza Izazi binti Mahathir. My student ID is 2019418898 and I come from class 17.
Acute lymphocytic leukemia, or the short form is ALL. It is one type of blood cancer which starts from young white blood cell called lymphocytes in the bone marrow. One of the characteristics is develops quickly over days or weeks, which means it takes a shorter time to grow up. And it is one of the most common type of leukemia that affects children. So, how does acute lymphocytic leukemia develops? In healthy bone marrow, stem cells will undergo a process called differentiation in order to become mature. When an immature lymphoid blood cell damage and develops error in genetic DNA, this disease will develop. These genetic errors eventually will give rise to a lymphoblast that is stuck during the earliest stage of cell development. This immature blood cell cannot mature into a functioning blood cell. As a result, leukemia cells multiply uncontrollably, which accumulate in the bone marrow. So, the next subtopic is risk factor of acute lymphocytic leukemia. A risk factor is something that increases our chance of getting a disease such as cancer. Some risk factors such as smoking can be controlled, but others like a person's age or family history can't be changed. But having a risk factor or even several risk factors doesn't mean that you will definitely get the disease. This is because some people who get the disease may have a few or no non-risk factor. So, one of the factors is radiation exposure. Treating cancer with radiation therapy may increase our chance of getting this disease. Besides, being exposed to a lower level of radiations, such as imaging tests like X-ray, regularly may also increase our chance of getting this leukemia disease. Next factor is chemical exposure. Being exposed to chemicals or chemotherapy drugs such as benzene. Benzene is widely used in our daily life. It is one of the products that been used in many industries such as producing glues, cigarettes, making detergents, art supplies, and paint stripper. Third factor is viral infection. Infection with human T-cell lymphoma can cause a rare type of T-cell acute lymphocytic leukemia. Most of these cases occurs in Japan and Caribbean area. Next is genetic syndrome. Genetic syndrome is seen to be one of the factors that may increase the chance of getting this acute lymphocytic leukemia. For the example is people who have Down syndrome, Klinefelter syndrome, or neurofibromatosis. Not forget to race or ethnicity also becomes one of the risk factors for acute lymphocytic leukemia. For the example is in America, this disease mostly occurs among white people compared to Africa. Next is age. Researchers state that this acute lymphocytic leukemia is likely to occur among children and also adults who age 50 years and above. Last but not least is gender. Acute lymphocytic leukemia is more common in males compared to female.
Hi, I will talk about the symptoms of acute lymphocytic leukemia, or we simplify it as ALL. Symptoms are fatigue or anemia. This occurs when normal red blood cells cannot be produced because the bone marrow is overcrowded by leukemia cells. Bruising and bleeding easily. This is because the low level of platelet in our body. The patient of ALL might have nose bleeding or bleeding gums when they clean their teeth. Shortness of breath. This happens because the body do not have enough red blood cells. Pale skin. Swollen lymph nodes around the neck, underarm, abdomen or groin. Frequent infection. The patient pick up infection like cough and cold easily, or the cough or cold lasts longer than normal. This happens because the body do not have enough healthy white blood cells to fight bacteria and virus. Bone pain and tenderness and abdominal fullness. The patient might feel discomfort in their tummy because their liver and spleen are swollen. Then, the treatment for acute lymphocytic leukemia. Treatment for acute lymphocytic leukemia is divided into 3 phases, which is induction therapy, consolidation therapy, and maintenance therapy. The induction therapy was to kill most of the leukemia cells in the blood and bone marrow to allow the production of normal blood cells. Consolidation therapy aimed at destroying any remaining leukemia in the body, such as in the brain and spinal cord. Maintenance therapy was to prevent leukemia cells from regrowing. The main treatment for acute lymphocytic leukemia is chemotherapy. Chemotherapy use anti-cancer drug like cytotoxic to destroy cancer cells. Chemotherapy kills many of healthy bone marrow cells as well as the leukemia cells because chemotherapy does not know the difference between cancer cells and the normal cells. Steroid. Steroid used to treat acute lymphocytic leukemia are usually a type called corticosteroid. Steroid often given with chemotherapy to help destroy leukemia cells or to reduce allergic reaction to some chemotherapy drugs. Targeted cancer drugs. This work by targeting the differences in cancer cells that help them to grow and survive. The main targeted cancer drugs used for acute lymphocytic leukemia is tyrosine kinase inhibitors. Then, radiotherapy. This therapy uses high energy radiation to kill cancer cells. Radiotherapy not only kills leukemia cells, but also normal bone marrow cells. This helps to prevent the rejection of stem cell transplant. Growth factors. Growth factors is a natural substances that stimulate the bone marrow to make blood cells. It helps to increase the white blood cells after chemotherapy. Eat through injection, like under skin, in tummy, arm or leg. Stem cell or bone marrow transplant. It allows the patient to have high doses of chemotherapy and other treatment. The stem cells are collected from the bloodstream or the bone marrow. The aim for this treatment is to put it into complete remission. Means there is no sign of leukemia cells. So if there is a sign of leukemia cell, the doctor might suggest the patient to have stem cell or bone marrow transplant.
A young child named Jenny was diagnosed having acute lymphocytic leukemia. So, her parents do not understand why infection is a major problem for Jenny when her white blood cell is high. So how does this disease occur? So this disease occur when bone marrow produce excessive lymphocyte in the body. So these lymphocytes are not fully mature and therefore cannot function properly. So the immature lymphocyte count is extremely high in the body, and this cell overcrowd the bone marrow. When this happens, there is no space for other types of blood cell to grow as a normal cell. So this causes a lower production of red blood cell, other type of white blood cell, and platelet in the body. This happen in the stem cell when DNA mutation happen in the bone marrow due to chromosome translocation. So this mutation lost ability to differentiate and divide uncontrollably in the bone marrow that we call as lymphoblasts. So new lymphocytes do not develop into matured cell but stay as immature cell called lymphoblasts. As we mentioned earlier, these lymphoblasts proliferate and replace most of bone marrow cells such as red blood cell, other types of white blood cell, and also platelet in our body. So this causes our body to have a symptoms as anemia from not enough supply of red blood cell, bleeding because of a low level of platelet, and also this leukemia cell can also spread to our brain. So to conclude all this acute lymphatic leukemia, we can say that even though we have a higher white blood cell count in our body, doesn't mean it can prevent us from getting any infection. As we all know that white blood cell function as fight infection, but when we have a higher white blood cell count in our body, this will lead to other problem, as we all know that before. The bone marrow will provide DNA mutation as other cells such as red blood cell and platelet do not grow in a normal ways.